As soon as government stuck its tentacles into our healthcare system many, many decades ago, it was over. And Obamacare compounded the problem. And so now we are staring into the healthcare abyss. So what's the solution? Obamacare is a clear failure, needs to be repealed, but that ain't going to happen, is it? Joining me now from New York City, family physician and healthcare policy expert, Dr. Jonathan Vitale. Doctor, what the Republicans are doing in the Senate, I don't think is a wise move. It's a procedural move. They're coming up with this plan, quote, I use air quotes, in secret. They're not sharing a lot of information. We have to glean what we can. But the bottom line is, here's the question. Are we going to get from this Senate plan a patient-centered system where it returns the doctor-patient relationship in an affordable way?
Well, first of all, Graham, thanks for having me. I think that's the question, and we don't know the answer to that, right? I mean, look, the Senate bill has been drafted in secrecy by Mitch McConnell and a few upper-ranking staff members, for all we know of Senate. Many Senate GOP members are even frustrated that they haven't even seen this bill, which is supposed to be released tomorrow and voted on next week. So we don't really know what's going to be in it, but we do know that it's probably going to be a lot different than the House bill that was given to the Senate. But look, I can almost guarantee that this is not going to be the full repeal and replace of Obamacare that we've all been hoping for, so that we could get back to that patient-centered medicine. You know, look, every doctor in America wants what patients want. We want an accessible, affordable, patient-centered healthcare plan, which is available for people based on their specific needs. There's no one-size-fits-all solution.
No.
And I certainly don't think we're going to get that this week.
No, and I was just explaining this, trying to explain this to my 21-year-old, that it's not the way it was, 30, 40 years ago when I was younger. And she said, Dad, no, it's not.
Yeah.
It's a mess, frankly.
Yeah.
And, she's got some tough decisions to make, as many young people in this country her age have to make. Meantime, the Democrats are in shameless mode right now, trying to scare people, trying to say that Republicans, Paul Ryan, et al., are pushing Granny off a cliff. Here's a sampling. Roll tape.
Yeah.
Being able for her to have access to health care and affordable health care for the rest of her life is, it's not even an option.
We have lots of care that is required for Taylor. I can't imagine what that would look like without insurance coverage. And I applaud you, senators, for working towards keeping something intact for our children.
If we didn't have Medicaid, we would have been financially ruined. And we're, a young family, so we'd have no shot.
Nobody is doing away with Medicaid. In fact, it's just the opposite. So these are scare tactics from the Democrats. But I want to look at the Senate plan. The plan, at least we think that could emerge, Doctor, out of the United States Senate from the Republicans. Number one, repeal the individual mandate. That's what it's looking like. Repeal all or most of the ACA's taxes. Phase out the Medicaid expansion. We'll talk about that. Establish a system of tax credits. Want to talk about that as well. Allow states to opt out of the ACA's mandates for pre-existing conditions and minimum insurance coverage mandates. Those are the mandates, for example, that I pay for mammograms. Okay, let's start with the repeal of the individual mandate. On paper, that's what's going to happen, but in reality, what's going to happen is that young people like my daughter can look at this and say, hey, there's no mandate. That means I don't have to buy insurance, and I only have to worry about it when I get sick.
Yeah, and then when she buys insurance, she's got to pay a penalty to the insurance company, right, rather than to the government. Look, the individual mandate is still there. It's just in a different form. It's to the insurance company versus the federal government. Same thing with the subsidies. They're still there, just in terms of these refundable tax credits, right? So there's really not a lot of changes in the original bill that the House got. And I don't think that the Senate is going to tinker with those points that much. I think what's going to be the biggest sticking point is going to be the Medicaid expansion, right, which is very controversial, as well as pre-existing conditions. Those are going to be the biggest issues from this plan that's going to come out. And we don't know exactly what it's going to look like yet. But a point I want to make, Graham, about Medicaid, which is very important to make, is, look, Obamacare put about 11.8 million people, just shoved them into these broadened Medicaid programs. Many of those folks would have qualified for Medicaid even before Obamacare. And Medicaid was never designed to take care of all of these people. Medicaid is designed to take care of the poorest people, pregnant women, children, disabled folks, and elderly who need extended care. It was never meant to kind of replace regular health care for folks who are well above the poverty level. So we have to really understand here what Medicaid is, and states need to take a lot more responsibility, especially those 31 states who signed on the dotted line to get the Medicaid expansion. They need to take responsibility in using these dollars wisely and using them to really take care of their individual populations.
Well, the federal government,
which vary a lot throughout this country.
Through the ACA, they raised the threshold. In other words, you know, if the cutoff was making $10,000, $15,000 a year, all of a sudden the cutoff is making $30,000 a year. So the system has been flooded. And you, as a doctor and other doctors, we should be clear on this. You don't have to. There is no mandate for you to take Medicaid patients, right? So this is creating a backlog, is it not?
Yeah, and this is an important point. There's no mandate that we cover patients under Medicare, Medicaid, or even Obamacare exchange plans. But, you know, doctors want to cover these patients because they need our help, and we want to. But this is a very important point. A lot of doctors can't afford it. They cannot afford to have a practice that sees a majority of these patients. So what ends up happening is patients can have all the Medicaid in the world, but if they do not have doctors who are able to take care of them, it does not matter. So that is a very big sticking point there, Graham.
Finally, one of the major cost drivers of Obamacare that is not being repealed, that's just kind of being reshaped by the Republicans in Congress right now, are the regulations. Those largely, from what I understand, are going to remain in place without getting too deep into the weeds. The bottom line is, when we look at what we know about this plan, I don't believe this is going to drive down costs in any way, shape, or form. Do you?
No, it probably won't. I mean, we already see how far up the premium prices are going, now above 200% in some states. They're out of control. But honestly, the only thing that's really going to help the premium prices go down is the free market, right? And we're not seeing much of that happening, especially not when there's much government intervention. And I'm not optimistic that we're going to see that in the Senate plan. You know, if you give somebody $14,000 and you say you can buy a health insurance plan with this $14,000, well, guess what? No health insurance plan is going to be under $14,000, right? So we really need the free market to step in, especially with pre-existing conditions, to let folks join associations so that they can have more purchasing power and buy good plans for really competitive prices. Free market principles, Graham, and we're just getting away from it in this country.
Yeah, fact is, the only way out of this is the free market. But as long as there is really any form of government health care, I think, whether it's the VA or some form of Obamacare, Medicare, I don't think we're ever going to get out of this ultimate death spiral toward eventually, I hate to say it, eventually single payer. Doctor, thank you. Coming up next, the phony Democrat attack on Donald Trump over Article 1, Section 9 of the Constitution as the Daily Ledger continues.